Mahesh Gopa Shetty. I head the liver transplant department at BGS Gleneagles Global Hospital, Kangeri. This time, the organization has chosen fatty liver awareness as the theme for creating awareness of liver diseases for this year. So I'm going to explain what this fatty liver disease is, or NAFLD, what we call it as, and I will also explain what are the causes and how to treat and how to prevent. So fatty liver disease is commonly seen in diabetic patients. It is also seen in people who are on the obese side. It is also seen in children, and the common cause for fatty liver disease is diabetes and intake of fructose containing sugary liquids, taking in a lot of carbohydrates, eating a lot of fried food, eating junk food. All these lead to fatty liver disease. How do we identify that somebody has a fatty liver disease? People who have diabetes or people who are on the obese side, they should get tested with a few blood tests and ultrasound scan. If it is needed, your specialist doctor can advise whether fibroscan is needed or not. If the LFT is abnormal and the ultrasound says you have fatty liver disease, then you need an expert. You need to see an expert, and the expert will usually recommend a fibroscan and or a liver biopsy. He may also start you on certain medications, but more than medications, what is important for these patients is the diet and exercise. If you lose more than 7 to 10% of your body weight, then fatty liver can reverse. If the fibrosis has set in, then it may not be reversible. People who have fatty liver or who already know that they have some kind of liver disease, they should not take alcohol. Taking alcohol accelerates your liver damage. Who is at risk of developing fatty liver disease? These are the patients who have type 2 diabetes or who have diabetes, people whose BMI is more than 23, especially among Indians. These are the people who are at risk of developing fatty liver disease. Fatty liver disease is not restricted to adults alone. Even children can develop fatty liver disease. Children as little as 8 years have developed end-stage liver disease because of fatty liver disease. So it is important that you make sure that the children eat healthy and they are active. What are the symptoms of liver disease? What the nature has given us is about 70% of liver in excess. Until more than 70% of the liver gets damaged, we will not even know that we have some kind of liver damage that is going on inside our body. The first sign that people may see is weakness. Other symptoms that we see in patients with liver disease is swelling of the feet, distended abdomen. Some people in extremes, we also see vomiting of blood, passing of blood in stools, and jaundice is typically seen as one of the last symptoms. Jaundice is not seen in early stages. How do we diagnose fatty liver disease? It's using combination of blood tests and ultrasound scan, and there are some other tests as well, like fibroscan, CT and MRI, which can quantify the amount of fat in the liver. But the amount of fat in the liver does not translate to the progression of disease. Typically, we don't recommend a CT or a MRI just to assess the amount of fat in the liver. If the liver functions are abnormal, then you must see a specialist, and your specialist is likely to advise a liver biopsy. Liver biopsy will tell us whether there is any fibrosis in the liver and the extent of fibrosis in the liver. If the fibrosis is beyond what we call as F2, then it is not likely to reverse. If it's between F1 and F2 with appropriate diet intake and weight loss, it can be reversed. If the fatty liver progresses, then they develop what we call as end-stage liver disease or cirrhosis. And once the cirrhosis sets in, the only option to cure for these patients is with liver transplant. Who needs an isolated small bowel transplant? These are the patients who lose their entire length of intestine for one or the other reasons. Most common reason being clotting of the blood supplying the intestine. These patients develop gangrene of intestine, and in order to save their life, the surgeon usually ends up removing the gangrenous part of the intestine. If the patients lose the entire length of intestine, obviously, these people will not be able to eat, and these people will need what we call as TPN, that is food being given through a big vein by placing a small cannula into that big vein. Since these patients are not able to eat and they are dependent on TPN, small bowel transplant becomes life-saving for these patients. While they are waiting for small bowel transplant, these patients will need TPN, and we have a full-fledged team, including dietitian, surgeon, medical gastroenterologist, and we work as a team and we educate these people how to take care of the TPN and be alive until they get a suitable small bowel transplant. Small bowel transplant for these patients, we get it from cadaver donor, brain dead organ donors, and the government has set up a beautiful system where we register these patients, and whenever there is a suitable organ donor, they get it. Here, the entire small bowel is transplanted with its own new blood supply. After the transplant is done, these patients will be able to eat and lead a normal lifestyle.